Decision-making models provide the how to move from principles to an action plan. Without a model, decisions risk being inconsistent, influenced by bias, rushed under pressure, lacking in transparency. A structured model creates a process that is clear. You can explain why you chose a course of action, consistent, similar cases are handled similarly, defensible. Your reasoning stands up to scrutiny. 2. Key features of an ethical decision-making model. While models differ, they often share these steps. Identify the problem. What's the ethical question? Gather relevant information, clinical facts, patient values, legal requirements. Identify stakeholders. Who will be affected by the decision? Consider ethical principles. How do autonomy, beneficence, non-maleficence, and justice apply? Identify options. What possible courses of action are available? Evaluate options. Weigh risks, benefits, and moral acceptability. Decide and act. Choose the best option and implement it. Reflect and review. Learn from the decision for future cases. 3. The 4-box method. One of the most practical tools in healthcare ethics is the 4-box method, developed by Johnson, Siegler, and Winslade. It organizes facts and principles into 4 categories. Medical indications. What are the clinical facts? Is the treatment medically indicated? Patient preferences. What does the patient want? Do they have decision-making capacity? Quality of life. How will treatment affect the patient's quality of life? Contextual features. What social, legal, financial, or institutional factors are at play? Example, a terminally ill patient refuses further chemotherapy. Medical indications. Treatment may slightly prolong life, but will cause severe side effects. Patient preferences. Prefers comfort care and staying at home. Quality of life. Treatment likely reduces comfort and mobility. Contextual features. Family members disagree with patient's choice. Using the 4 boxes clarifies that respecting patient preferences and quality of life aligns with ethical principles. 4. The moral model. Another widely used approach is the moral model, Theroux and Kraseman. M. Massage the dilemma, define the issue, identify stakeholders. O. Outline the options, list possible actions. R. Review the criteria and resolve, apply principles and values. A. Affirm your position and act, decide and implement. L. Look back, evaluate the process and outcome. Example, a nurse discovers a colleague has been diverting pain medication for personal use. M. Identify the ethical issue, patient safety and professional misconduct. O. Options, ignore, confront privately, report to supervisor. R. Non-maleficence and justice require reporting to protect patients. A. Report through proper channels. L. Review how the report was handled and whether systems can be improved. 5. The 7-step decision-making model. A more detailed model often used in nursing and ethics committees includes state the problem clearly, gather information and identify stakeholders, consider ethical principles and theories, identify possible actions, compare actions with principles and values, make a decision and act, evaluate and reflect. This model is especially useful when multiple principles conflict, as it forces you to compare and prioritize. 6. Applying models in conflicting principle cases. Let's look at an example that pits autonomy against beneficence. Case: a competent adult patient refuses a blood transfusion due to religious beliefs even though it is life-saving. Autonomy: respecting the patient's decision is paramount. Beneficence: providing the transfusion would save their life. Using a decision-making model helps clarify. The patient's capacity is intact. Autonomy prevails. Beneficence does not override an informed, voluntary refusal. By documenting this reasoning, the care team protects both the patient's rights and the integrity of their decision. 7. The role of ethics committees. Hospitals often have ethics committees to support decision-making. These committees provide a forum for discussion, offer diverse perspectives, physicians, nurses, legal experts, chaplains, help resolve disputes between providers, patients, and families, offer education on ethical principles and processes. While the final decision still rests with the care team and patient, committees can help ensure the process is thorough and balanced. 8. Integrating cultural sensitivity. Ethical decision-making must account for cultural diversity. Different cultural backgrounds can shape definitions of family involvement, attitudes toward truth-telling, end-of-life preferences. A model that ignores culture risks making ethically sound but culturally insensitive decisions. Example: in some cultures, the family, not the patient, receives the diagnosis first. A rigid insistence on direct patient disclosure might violate cultural norms and damage trust. Models should be flexible enough to account for this. 9. Common pitfalls in ethical decision-making. Rushing decisions under time pressure. Over-reliance on personal values without considering the patient's failure to document reasoning. Avoiding conflict by making the easiest choice rather than the most ethical one. Ignoring systemic issues that contribute to the dilemma. 10. Discussion scenarios. Scenario 1. A pregnant patient with cancer refuses treatment to avoid harming the fetus, even though it may shorten her life. Scenario 2. A patient requests a medically unnecessary antibiotic because it worked last time. Scenario 3. A teenager seeks birth control without parental consent in a jurisdiction that allows it. In each case, use a model to identify the ethical issue, weigh relevant principles, consider cultural and contextual factors, decide and justify the action. 11. Strategies for using models in practice. Make the model part of your routine for complex cases. Involve the whole care team in the process. Seek ethics consultation early, not as a last resort. Document the reasoning clearly in the patient record. Reflect on past cases to improve your future decision-making. Closing reflection. Ethical decision-making models do not give us all the answers, but they give us something equally valuable: a clear, thoughtful way to arrive at the best possible answer in difficult situations. In healthcare, where lives and dignity are at stake, guesswork and habit are not enough. We need a process, a disciplined way to move from principles to action, from uncertainty to clarity. And when we follow such a process, we honor not only the patient in front of us, but also the trust that society has placed in us as healthcare professionals.